Before we begin, please take a moment to review the disclaimer in the episode description. Remember, this podcast is for informational purposes only and is not a substitute for medical advice. Now let's get started. Welcome to Wound Basics, the podcast that does exactly what it says on the tin, helps people to understand the basics of wound care. I'm Dr. Frances Henshaw, and my guest today is Anne-Marie Dunk, Clinical Nurse Consultant for the Tissue Viability Unit at Canberra Hospital, and we'll be discussing a very common type of wound, the skin tear. Welcome, Anne-Marie.
Hi, Fran. Thank you very much for inviting me.
Oh, I was desperate to get you on to talk about skin tears. So let's start by defining what is a skin tear.
Well, definitions are really perfect because they allude to why you actually might have that damage at your skin. So a skin tear is a traumatic wound caused by mechanical forces, including the removal of adhesives. Severity may vary by depth, but doesn't extend through the subcutaneous layer of the skin. And it's recommended that they're recognised as a unique and complex wound etiology distinct from other wounds, like we have discussed a few other wounds in recent times, like pressure injuries and IAD, and skin tears sit alone as well.
Yeah, so skin tears have their own classification systems, don't they? So we can actually document them and everyone knows what we're looking at. Can you tell us about those?
Yeah, this classification system that I'm very familiar with is the ISAP skin tear classification system. And it looks at three types of, severity of damage in this space of skin tear. So the type 1 is no skin loss, which alludes to a linear or a flap tear, which can be repositioned to cover the wound bed. The type 2 is partial flap loss, which cannot be repositioned to cover the wound bed, and it's all lumpy and sort of sits there uncomfortably on top of your skin tear. And when you're looking at as type 3 is a total flap loss, that all the skin's gone and exposed the entire wound bed.
Aha, you've explained that very well. I had a nurse who finally got it into my head once by saying the three stages are flap, half a flap, and no flap. And that made a lot of sense to me. But just to complicate things a little bit, there's another system called the STAR classification system. Now, the STAR classification system has a slight more layer of complexity to it. So it probably gives us a little bit more accuracy, but obviously it's harder to remember because there's more categories. So there's a type 1A where the skin edges can be realigned and there is a flap, and type 1B where the flap itself is maybe pale or dusky or darkened, suggesting that it's probably not in very good condition. Same for the half a flap, which is number 2. And then 2B is again where the flap is pale, dusky or darkened. So the main difference is one actually categorises the state of the flap, because I guess a flap that is looking pale or dusky is perhaps not likely to be as likely to survive as one that's nice and healthy looking. Is that the premise of that system, Anne-Marie?
Absolutely.
So really, the visual indicators that healthcare workers should be looking for when assessing a skin tear are the flap and how it's positioned, whether there is a flap or isn't one, and how well it covers the wound.
That's right.
So how do people differentiate between a skin tear and other types of wounds like abrasions or ulcers?
Abrasions are very interesting because they actually go down through the layers of skin into the subcutaneous fat layer. So they are a lot deeper, and you would often treat that by, say, some sutures or something like that. The other place you'll definitely find skin tears is like the lower legs and the lower forearms right down to the hands. They're the most common places we find skin tears in the people that we care for.
Right. So they're usually on the extremities. They're usually an acute wound. Do we often get bleeding with skin tears?
Yes, we do. And that's often related to some of the medications that the people that we care for are on, but they can have bleeding. And we just manage that with some of our management practices.
Okay, so it's really the acuity of them and the fact that they are in these locations that are more common on the extremities that really help us to identify a skin tear as a skin tear. So I think they're probably one of the more easy wound types to actually identify, aren't they? And often there is a kind of accident that goes with them as well.
That's right. Many of the causes are a blunt trauma, like a bump, a fall, while performing activities of daily living, like getting around the house or getting around their room and bumping into chairs. Like we said, it can be an adhesive, so maybe changing a dressing, you can tear that skin a little further if you're not very careful. And maybe during transferring a person that you're caring for, like there's a little bit of friction and shear that goes on, and that can cause a skin tear. Side rails to beds, wheelchairs are all big danger things. And they are considered an acute wound, like you mentioned before. But if they don't heal in a timely manner, they can go on to be a chronic wound and problematic for us. So there's a lot of things that can actually cause skin tears. And can you just give us a couple of strategies to preventing them? Prevention really looks at a few strategies. And one is about the skin and what you're seeing at the skin. Thinking about the patient's mobility or the person's mobility, how able they are to move around easily and freely. And their general health is a really important thing. Doing a good skin assessment, seeing if their skin's too dry or too moist, is also essential. Once again, locking in all that skin assessment.
Yes, skin assessment does seem to be really important in finding these things, finding skin that's vulnerable to things like skin tears. So if your skin assessment suggested that the skin was vulnerable to skin tears, what would the skin be looking like?
The skin will be very fragile, like paper thin, like a little bit of tissue paper. And also remember the other thing that was important, that as a healthcare worker, you might like to have shortened nails, less jewellery when you're touching your patient, because they're the things that actually can scratch the skin or aggravate it or pull it.
Absolutely. And I think there are little things like that are hacks that can really help to prevent these lesions from happening, and things like adhesives on dressings. Some adhesives will come off more easily than others, so that's something that people need to be mindful of when they're selecting certain dressings to go on people that they're looking after.
I think, Fran, the education of putting them on and also taking them off is equally important. If you are well educated on how to remove the dressings, you can minimise the skin damage.
Yeah, no, that's very important. And I think in terms of prevention, when we see this skin that is vulnerable, there is pathways there that we can adopt to stop skin from tearing so easily.
Yeah, absolutely.
And so what kind of things can, if you spot this skin that's looking quite fragile, what kind of daily care can you provide that might help a person?
Simple moisturising the skin, the lower arms and lower legs, once or twice a day can make a great difference to improving the skin. And you can find lots of publications. There's been some publications done in Australia, and that's Carolyn Carville's work, and they're easily sourced in the wider web.
Yeah, so there is some really good evidence out there that has shown that it is a very good idea to moisturise 2 times a day, and that can really distinctly reduce your chances of getting skin tears. So that's a good FYI, isn't it?
Yep.
So we've really gone through what is a skin tear. We've talked about what to look for, how to classify them. We've also talked about how to prevent them. And I think we've really given skin tears the once over. Have I missed anything here, Anne-Marie?
No, I think that all our ageing population are at risk of skin tears. And like all these wound etiologies we touched on, if you've had a skin tear in the past, you're actually more at risk of having a skin tear in the future.
Yeah, I think that's true for wounds in general, and a really well-made point. And Yeah, I think that there's a lot of simple things we can do to actually bring down our skin tear rates. And I think the other thing that we need to be very clear about is actually escalating these things and documenting them properly in accordance to the policy of wherever you work. Because just seeing something and watching it gradually fester is not the way forward. We actually need to make sure that an appropriate plan is put in place. Now, we're not here to talk about appropriate plans. That's probably something for a different episode, but I think it's very important that if you see something, say something. So, Anne-Marie, thanks so much today for coming in and talking to us about skin tears. It's been a very interesting wander through that world.
Thank you, Fran. It's been great.
Thanks for listening to Wound Basics. This show was brought to you by Smith & Nephew, shaping what's possible in wound care.